A little bit about the New Orleans region today, and what the numbers show there is that hospitalization for COVID patients and for PUIs is trending downward, and vent utilization is trending downward too. And if you look at the vent and hospital charts, and this is Region 1, so this is New Orleans. In Jefferson Parish, also St. Bernard and Plaquemines parishes. Where we are is on the red line, and if you look at today's date on the number of COVID in the hospital, it's about 790. Now, had we stayed on the trajectory that we were on before we issued the shelter-at-home, stay-at-home order, we would have, just in Region 1 today, according to the modeling, almost 3,000 people in the hospital. So that's 1,200 or so people that are not in the hospital today that would have been. And then over on the chart on the right, you can see ventilator utilization. We're at 156 in Region 1. We'd have been over 1,000 in Region 1 alone, which is why we were doing everything we could to surge medical capacity related to beds, ICU space, acute care beds, staffing, and ventilators, because we didn't know for a fact that we would get off of that curve. You'll remember a month ago we were reporting new cases on a pace that was leading the world. And so we're in a better place today precisely because the people of Louisiana, and in this case, Region 1, took seriously the stay-at-home order. They took seriously the need to practice social distancing and better hygiene, and it is literally paying off, because just as we talked about the number of deaths not just being numbers, those are real people. These are real people that we may never know the identity of, but they're not in the hospital and they're not dying because of the stay-at-home order. So this is really important, and I hope you all will help us to explain to the people of Louisiana just how critically important this is. And by the way, now is not the time to let up. As Dr. Fauci said, we need to be putting the accelerator all the way to the floor on these mitigation measures, especially as we move through the month of April, because it's all part of the president's 30-day plan that was added to the initial 15-day plan. So I guess it's a 45-day plan to stop the spread. And it coincides exactly with our plan here in Louisiana through April as well. But this is why we're doing it, to achieve these kind of results. And it's still sad that we have people in the hospital today, on ventilators today, in ICU. We have people dying today, but not in the numbers that we thought were going to be the case. And so I wanted to share that with you all this morning. I also have another chart to show you that have the trajectories of where we would be on cases of COVID in Louisiana. And this is, I'm sorry, not Louisiana, in Region 1. So this is the same area. And you can see the red line there with an R0 of 2.4. So that's basically you do nothing. And you allow people to interact as they normally would. You would have seen cases along the red line. R0 of 2.0 is some mitigation measures, but not too many, and not necessarily everybody participating, and you kind of see where you are there. 1.7 is the blue line, and then R0 of 1.3, that's a shelter-in-place order like I gave that people are following for the most part. And that's really where we're trending right now, is the 1.3. Quite frankly, a couple of weeks ago, we were doubtful that we would ever get to that line. And you have various data points that you can use to kind of determine where you are. New cases is not the best of them, but hospitalizations can tell you. And within hospitalizations, we can model on ICU utilization and vent utilization as well. And when you put all those things together, we know that in Region 1, our line is down around the 1.3. And so what that means is we're not transmitting COVID the way that we would if these measures were not in place. And so it's really paying off for us. And we're in a much better place than we literally thought was possible. So just wanted to share that information with you, and if you have questions about that, we'll get back to your questions later. And so, but this is all good news. Means we're headed in the right direction.